Hey guys, Dr. Jackson again from the Sports Pod. I wanted to bring you another quick video today and talk a little bit about something we see very often in our clinic, and that is plantar fasciitis. So plantar fasciitis is one of those injuries that a lot of people out here are somewhat familiar with, and it's kind of a catch-all term almost for like heel pain or like a burning kind of sensation on the bottom of your foot. A lot of people out there kind of just like lump all this together and say, hey, look, you got plantar fasciitis, when sometimes it's really not actually plantar fasciitis. And just to kind of clear things up, fasciitis is maybe not the best term to describe this, because oftentimes, patients that come to us with, quote unquote plantar fasciitis have been dealing with this for weeks or months or maybe even years. And so itis, the term itis essentially means inflammation, and it's usually there to describe something that's acute in nature, as in something that's only been around for a few hours or a few days at most. And so at this point in time, when it's been going on for weeks, months, or years, it's really chronic, and at that point it may even be more accurate to call it a fasciosis instead of a fasciitis, which means there's more of damage actually into the structures or the tendons, the ligaments, the muscles themselves, as opposed to just like inflammation in that area, which is causing some painful symptoms. So, what is plantar fasciitis? It's essentially, you have this fascia on the bottom of your foot, and it goes from your heel to the toes. And essentially this fascia becomes very tight or shortened, let's say, and then when you let's say get up in the morning or you stretch your foot, you'll cause all these little tears in that fascia, or even the muscles which attach to the heel, and this causes inflammation, and it becomes very painful. Oftentimes it may subside after a few minutes or a few hours, and then you usually won't have any issues as long as you're up and moving, because you have nice blood flow to the area, and it helps to kind of heal those tissues and decrease the pain. But then as soon as you sit or you become inactive for a prolonged period of time, and then you get up to move again, you have issues. So like I said, it's a little bit of a misnomer, but I'm going to show you real quick on an app I have just kind of the structures that could be involved, and then kind of how myself and my colleague Dr. Wu at the Sports Pod would treat this injury, and then we can kind of wrap it up. So I'm going to use this app right here. You can see that this is a calf. Okay, so that's your calf muscle right there. Let's see if we can get it a little bit more clearly presentation. But that's essentially your calf, and you can see how it swoops down and it attaches to the heel. And so your calf is actually just an extension of your Achilles tendon. So if I kind of move this around, I'm going to actually show you the underside of the foot. So if I highlight that right there, you can see that that's pretty much the plantar fascia, and it attaches to the heel and comes down to the toes. And that's essentially the structure that most people would say is involved here. But there's other like tiny little muscles in the foot, such as the abductor hallucis, you've got the quadratus plantae, you've got the Achilles tendon coming down and attaching there. And all of these tissues, if they're extremely tight or they're sensitive, can contribute to the cause. So oftentimes we find in our clinic that patients with quote unquote plantar fasciitis have extremely tight calves, they have tight hamstrings, and then the muscles on the bottom of their foot are just extremely tight. So what we like to do is kind of go in and take a non-traditional approach and just use soft tissue therapies, acupuncture, dry needling, to go in there, decrease the tension throughout that whole entire posterior chain, and that oftentimes will help alleviate symptoms. Also, we like to go in there and strengthen the tiny little muscles of the foot, and that'll help support your arch and help maintain proper positioning of your foot. So we tend to kind of steer away from orthotics, steer away from boots that immobilize the area, because as soon as you get rid of those, guess what? It's going to come right back. So that's pretty much it for today, guys. My name is Dr. Jackson from the Sports Pod. If you have any questions, feel free to comment. Social media info will be down here in the left-hand corner. If not, if you don't have any questions, I hope to hear from you soon. Feel free to come and check us out at the Sports Pod. If not, have a good one and move free, guys.